Hi everybody, welcome to our presentation on robots in healthcare. The first type of robot that I'll be talking about today are exoskeletons. Cyberdyne's hybrid assistive limb uses sensors placed on the skin to detect small electrical signals in the patient's body and respond with movement at the joint. They're designed to help rehabilitate patients from conditions that lead to lower limb disorders, which include spinal cord injuries or strokes. The current price to rent one of these exoskeletons is about $1,000 per month, which is a lot. The leading companies that make these exoskeletons are Cyberdyne, Rewalk Robotics, and Exobionics. In the future, the costs of these should decrease as output increases and the cost of the components go down, which includes sensors, electronics, and electrical engineering. As well as this, the technology should also get better and more accurate as brain-machine connectivity advances. Currently in Japan, a lot of airport and warehouse workers use biofeedback waistband lumbar support to prevent injury when they're dealing with a lot of heavy objects and materials. The next type of robot that I'll discuss are care robots. These are generally used to help care for the elderly and disabled. As numbers of caregivers run shorter and shorter, robots can do simple tasks such as helping people get in and out of bed, reminding patients to take medications. These robots can also be nurses' assistants and help with taking blood, recording temperatures, or improving patient hygiene. With robots doing these repetitive tasks, nurses have more time to focus on individualized patient care and devising treatment plans for their patients. Currently, the number of care robots in use are very, very low and mainly in Japan, but I think we should expect to see more and more of these. The next type of robot I'll be talking about are hospital robots. Aethon's Tug is an autonomous mobile robot. It can be used to deliver medications, laboratory specimens, and other material within hospitals. Basically, it's more of a robot to take things from place to place. They use sensors to navigate and Wi-Fi to communicate with elevators, automatic doors, and fire alarms. The company Xenex came out with a robot that disinfects and can undo an entire patient room in less than 20 minutes, which is much quicker than humans can do that. Like care robots, these help to eliminate the extra tasks that consume a lot of nurses' valuable time so that they can focus on the more involved tasks. The next type of robot and last type of robot that I'm going to be talking about are surgical robots. The major companies involved in surgical robots are Intuitive Surgical, Johnson & Johnson, and Medtronicare. Each of these different companies makes robots for different types of surgeries with different attachments that can be both disposable or reusable. For example of this, the Da Vinci system focuses on urological, bariatric, and gynecological procedures, while the Mako system from Stryker specializes in orthopedic surgery, specifically knee replacements. Intuitive, which is the market leader, had a global increase in procedures by 32% from 2017 to 2019, and since then the adoption of surgical robots in hospitals has been rapidly growing.
The application of robots in healthcare is going to be very, very prevalent down the line. We're talking over 50 years for some of these things, and a lot of them could be a lot sooner, depending on how much we invest, how much time we put into these operations. So, one thing for start, it'll help eliminate the human risk in high-risk surgeries and other duties. So, assistance with really like a brain surgery, heart surgery, things that if the doctor might mess up, which happens in a low percentage, but it'll help to even make that percentage a lot lower. So just make it a lot safer for the patients. Very much down the line, it can help to eliminate the need for healthcare workers at all. If we can automate them to do everything that we do, and we know how to do, and do it better than we can do, it'll make for cheaper healthcare for everybody and a more reliable healthcare with that. As of now, they have not surpassed the human ability to do so, but talking 50 to 100 years, it could be a major adjustment in healthcare. It'll help provide assistance and comfort to patients and visitors. So what that means is improve their recovery times and shorten hospital stays, get people in and out, which is just better for everybody. For example, Japan's population, a quarter of it is over the age of 65. So they're going to have a large shortage in healthcare workers within the next couple of years. What that means is there's going to be a lot of people in the hospital that won't be able to get the correct care that they need. It's going to be people are going to be working all day long to try to maintain and keep up with all the patients. If they can implement some type of AI robot to just help out with the tasks that are very repetitive, it's going to make it could save a lot of lives in Japan. So they're one of the main leading nations in developing a lot of these robots right now. It can save the lives of healthcare workers from deadly illnesses. So think about COVID-19. A lot of nurses, thousands of them, were getting sick from just trying to help and treat patients. If they had not come in contact with these severely ill individuals, send a robot in, take the temperature, check their vitals, go in, check on them every so often, we can eliminate the risk for these people in these positions to be getting sick when they're following all the procedures and everything, but a highly transmittable disease like that, a sanitized robot would basically eliminate that from ever happening. It can create targeted and personalized treatments. I'll get into that on the next slide. And it'll overall just provide a more efficient, higher quality, and a safer experience for patients all around the world. So with the targeted and personalized treatments, it can remove plaque from arteries, take tissue biopsies, and attack cancerous tumors directly by delivering medication to the patient in that area where they need it. In cancer, it's going to be very, very prevalent. It's already increasing every day. So they have the technology to send micro robots into your body and deliver drugs and medicine into the specific cells that are cancerous to try to treat you that way. Again, with the complex surgery, it'll reduce the time for these as well, which is great for getting people in and out, making sure you can get to everyone in a reasonable time. And then while they won't be, at least in the next, is predicted in the next like 50 to 100 years, they won't be strictly robots doing the whole surgery. They'll be assisting the doctors. So taking that percentage of human error out of it entirely, basically, and performing it quicker, just more efficiently. So we have a documented case of a surgeon performing surgery over distance with the new 5G that's been going on recently. So it wasn't possible before because of the latency. It would be laggy, so the timing wouldn't be perfect. But with 5G, it's got low latency, which is required to maintain connection the whole time, make sure everything is very quick. And so they had the doctor doing it, controlling the robotic arm. And this was 3 years ago, so I'm sure they've developed this technology a lot further and a lot more in depth, which is just really exciting for what we're going to see in the next 30 years. And they've already been progressing, and it's only continuing to progress as we go.
When doing the research about robotics in the healthcare system, we've pondered upon 3 discussion questions that help us understand how humans feel about robotics being introduced into the healthcare system. The first question we decided to do is, how would you feel about medical procedures being done to you with robotics incorporated? Are you more or less scared than you would be with a human? Why do you feel that way? The second question that we listed is, how would you feel about getting the diagnosis done with robotics incorporated? Do you trust them more or less than humans? Why do you think you feel that way? The third question we listed is, does the idea of the presence of robotic entities make you feel uncomfortable, uneasy, secure? Do you feel that robotics are smarter than humans, more or less susceptible to error? Asking these questions will give us a good idea on how humans trust, or think about robotics being involved in the healthcare system?